How do sickle cell medications interact with other drugs? Managing sickle cell disease often involves medications like hydroxyurea and Voxelotor, but these drugs don't work in isolation. They can interact with many other medicines, which can change how well treatments work or increase side effects. It's important to understand these interactions to keep treatment safe and effective. Hydroxyurea, a common drug used to boost fetal hemoglobin and reduce sickling of red blood cells, can interact with around 190 other medications. These interactions can be minor or serious. For example, if hydroxyurea is taken with allopurinol or methotrexate, it might increase the risk of low white blood cell counts, leading to a higher chance of infections. Combining it with drugs like ciprofloxacin can also affect how the body processes the medication, possibly leading to toxicity or decreased effectiveness. Because hydroxyurea impacts bone marrow function, combining it with other drugs that suppress blood cell production requires close monitoring by healthcare providers. Regular blood tests are essential to catch any problems early. Voxelotor is a newer medication that helps keep hemoglobin attached to oxygen, preventing sickling. It interacts with about 375 other drugs, including haloperidol and hydrocodone. These interactions can change how Voxelotor is broken down in the liver, which might cause side effects to increase or reduce the medication's effectiveness. For example, if a person takes drugs that influence liver enzymes, the levels of Voxelotor could become too high or too low, requiring dose adjustments or alternative treatments. Because of these interactions, healthcare providers carefully review all medications a patient is taking before starting Voxelotor. In addition to these specific drugs, many sickle cell patients need pain relief medications like opioids or antibiotics for infections. These drugs can also interact with each other or with the sickle cell medications. Opioids, for example, can increase sedation if combined with other central nervous system depressants, raising the risk of respiratory depression. Since sickle cell disease can affect organ function, especially the liver and kidneys, these interactions need careful management. To keep treatment safe, healthcare providers perform thorough medication reviews, regularly check blood counts, liver and kidney function, and adjust doses as needed. Patients should always tell their doctors about all the medicines and supplements they are taking. This helps prevent harmful interactions and ensures the best possible care. In summary, medications used for sickle cell disease, like hydroxyurea and Voxelotor, can interact with many other drugs, affecting how treatments work or increasing side effects. Proper management involves close supervision by healthcare professionals, personalized treatment plans, and ongoing monitoring. Always consult your healthcare provider before making any changes to your medication routine to keep your treatment safe and effective.